This is part 2 of how exercise affects bone mineral density. There's a positive correlation between bone mineral density and muscle strength and muscle mass. This means that the more muscle strength and muscle mass we have, the greater the chances of us having sufficient bone mineral density. When we begin a training program, there's 2 principles we want to remember. First, we want to remember the principle of progressive overload, and second, we remember the SAID principle. Progressive overload means that we are increasing either the volume or intensity of what we are doing. When we want to increase the volume, we can either increase the sets or reps. For example, we may start by doing sets of 8, and then after a couple weeks, we'll start doing sets of 10. If we're going to increase the intensity, we'll increase the weight we are doing. So we may start at 10 pounds, and then after a couple weeks, we will move up to 15 pounds. The SAID principle means that the bones that we load will be the bones that adapt. For example, if you run a lot or walk, you may have great bone mineral density in your lower body, but your upper body may have less bone mineral density. This is why it's important to make sure we are training our whole body. That way we don't have any imbalances in bone mineral density between our upper and lower body. Resistance training is also essential for youth. By resistance training, as they grow up, they will have a higher peak bone mineral density than they would otherwise, which can really benefit them into older age.